Member for Higgins.
Thank you, Deputy Speaker. The other day, I bumped into a medical colleague of mine, and he disclosed that he'd met a nurse. Now, that in itself is not remarkable. However, this nurse was actually driving a tram, and this nurse was no ordinary nurse. She was an ex-intensive care nurse. So it speaks volumes that we have now got a situation where the health system is hemorrhaging human capital that is not going to be able to be replaced overnight. And this problem, obviously, has been going on for some time now, and it was made worse during the pandemic. The pressures of the pandemic undoubtedly exacerbated the problems with workforce. And it's no coincidence that it has exacerbated a workforce that is feminised. The health workforce is feminised, as is the aged care workforce, as are teachers. And these and childcare, thank you. These workforces are hemorrhaging because they are also feminised workforces. Women are that sandwich generation. We're caught between the pressures of home duties as well as dealing with ageing parents. And in addition to that, we're also we belong to these caring professions. So it's no doubt that all of this has led to a situation of, I think, mental and physical exhaustion, to be honest. And here in this House, we are well aware of that. And I think it speaks volumes that in this Parliament we have probably got the highest number of healthcare professionals, people with lived experience, like my colleague, Emma McBride, and the member for Indi, and I thank her, excellent representative for her community, a former midwife and researcher who has lived experience and understands the pressures on the health system. So, coming from that position now, we have to craft policy. We have to craft policy to course correct and to invest in human capital. And when I got the list, I actually got this list of amazing initiatives that the Albanese government is delivering, and I can't see a single hospital being built on this, and I'm actually kind of happy about that. There's no point building hospitals if you can't staff them. And actually, the bulk of our initiatives are focused on training and workforce. And there was one particular initiative I spoke on not long ago, which was, and I particularly like this, and it speaks to the maldistribution of the healthcare workforce. Currently, oversupply in the cities and the metropolitan areas, and an absolute scarcity in our rural and regional areas. And there's just one act, there's an amendment to a Higher Education Act which will look to waive help fees for those rural doctors and nurse practitioners who choose to work in either regional or remote communities. And the further out you go, the more debt is waived and forgiven, essentially. And that's not trivial, because it can amount to something like it can amount to something like $8,000 for a nurse practitioner and up to $10,000 for a doctor. So that is not a trivial amount of money, particularly during a cost of living crunch that we have now. So I sincerely hope that that encourages more of our trainees to go into the regions. And as you know, I worked at the Alfred, and for the 13 years I was there, I could count on one hand how many medical students were planning on becoming general practitioners. One hand, probably two in 13 years. The problem is, of course, they enter the public hospital system, which is generally in big metropolitan cities. These are the doctor factories, the nurse factories, and they get seduced. They get seduced and they decide they want to become a trauma surgeon instead of working as a general practitioner in the regions. And the irony of all of that is, from my own lived experience, the most fulfilling rotations I had were actually in the regions, in places like Lismore, in Orange, in Bunbury, in Rockingham, in Gladstone. I've worked all over this country, and I've got to say working in the regions is just the most fulfilling experience, because the communities are so grateful that you are there. They are so grateful. So I would strongly urge our prospective trainees to consider the regions and to be deliberate about their choices, and understand that as a government we are doing everything we can on this side of the House to invest in our regions. And in addition to training programs, obviously mentorship programs are just important. We need those health practitioners with the grey hairs, I have quite a few actually, to mentor the next generation coming through. Thank you.
Thank you.